Chris McLeod is fighting to get new drugs for cystic fibrosis patients brought to Canada at a time when patients are most at risk. Vertex Pharmaceuticals says it will provide their CF drugs for free for the next 90 days in Canada if the federal government comes to the table and negotiates a price listing agreement. Chris McLeod, who has CF and is the chair of the Canadian Cystic Fibrosis Treatment Society, is joining us this morning. Thanks for being here.
Thanks for having me.
This deal, in fact, would give CF patients access to 3 drugs, plus a new drug called Trikafta, I hope I'm saying that right, which has been approved by the FDA. So where is Canada at in negotiations with the drug company?
Well, it's a 5-alarm fire bell. The provinces that are in charge of negotiating are refusing to negotiate for the existing drugs that have Health Canada approval that are not yet listed on the provincial formularies. The federal government has new amendments to the Patent Medicine Review Board. Those amendments are precluding pharma companies from submitting to Health Canada new drugs such as Trikafta. So we're not getting Trikafta submitted by the pharma company to Health Canada because of the amendments to the Patent Medicine Review Board. The provinces are refusing to negotiate with Vertex for the existing stable of drugs. And we're in by what the Premier and the Prime Minister, in their own words, would call a crisis with COVID-19 that affects the most vulnerable, of which CF patients are at the pointy end of the spear.
Really getting lost in a lot of red tape, it sounds like. One of the 3 drugs that CF patients could have access to which is Kalydeco, which was given to you on compassionate grounds a few years ago because of your condition. Has it worked for you?
Okay, well, it's a game changer. 2012, 5 months of 6. I was at St. Mike's Hospital, 4 liters of oxygen a minute, less than 30% lung function, being lined up for a lung transplant. 10 days after I get the drug, I'm at 55% lung function, and I've been working 60, 80 hours a week ever since.
Wow.
Creating jobs and working with my partners at our practice at Cambridge LLP. So it works. Proof is in the pudding. Other people with Trikafta have had phenomenal results. By the way, Trikafta is being given on compassionate grounds to those who are closest to death in the country now. I believe there's about 90 patients that are on Trikafta on compassionate grounds. But we need 5-alarm fire bell. Doug Ford said this week, you know, I'm going to ask public health officials to pull up their socks.
I'm sorry we have run out of time. I want to thank you for being with us on your morning. I should also mention we reached out to Health Canada for a statement and did not receive one. Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.